Welcome to the Team Teach podcast. I'm Clare, and in each episode you'll find me talking with an expert guest to learn more about behaviour. We squeeze a lot into each episode. You'll listen to the latest thinking in behaviour, continue your professional development with our book recommendation, and then I'll send you away with 3 practical tips you can use in your setting. I'm joined today by Dean Burnett, and we are talking about how the brain influences behaviour. Dean is a returning guest. He has done an episode on My Family Coach, so do check that one out as well. But I just wanted to say, first of all, hi, Dean. Nice to see you again.
Hello, Claire. Nice to see you too.
And could you tell the listener a bit more about yourself and what you do?
Yeah, generally, I'm Dr. Dean Burnett. I am a neuroscientist by training, but I'm a full-time author these days, also science contributor, communicator, pundit of general purpose. Do a lot of consulting work and people who need to know about how the brain affects things related to their field. Go to sort of contact for anyone who needs brain-based stuff explained. Do a lot of educational outreach and programs. Currently a big part of the Head for Change Brain Safe campaign, which I put together myself with help of a few others to teach kids about the importance of avoiding head injury in sporting practices and playing and things like that. And a mental health ambassador, amongst other things. I have a strange CV. I like to keep busy, and I do a lot of podcasts. Hence I'm back, I suppose.
A returning guest is always a good guest in my mind.
I know, it's the first time anyone's ever asked me back, so we'll see.
Well, I'm genuinely really interested in this topic. I think it's absolutely fascinating. So it's so great to have, an expert in the field. And I know you would have done this question on a previous podcast when I've interviewed you, but it's reflective. It's what you wish you knew then that you know now about the topic.
I think talking about when I first started becoming active in the field of communicating science and sort of sharing the insight about it, I was one of those regular scientists, I think still counts the majority, who sort of downplayed or ignored the importance and the role of emotion. I know it's one of those, it's a common mainstream sort of conception that thinking and rationalization and sensory stuff and perception is all the complex stuff, and emotions are like some sort of like an evolutionary appendix of the brain. They're just still there. We'd be better off without them, but they're there, and they occasionally cause a mess and sort of flare up. But no, like I went through several years of sort of realigning my thoughts about this. And emotions are such a key part of our mental makeup, and they have such a big role to play and influence how we understand the world. They've shaped us and how we are. And this, the idea of just downplaying them or dismissing them as annoyances is unhelpful overall. And if I'd known that then, I probably would have done a few things differently, or at least better. Got to a certain endpoint faster than I would have done if I wasn't so preoccupied with more intellectual things. Thinking these were, emotions are very significant, and as we'll see, I'm sure, in this discussion.
I think we absolutely will. And that's, really interesting that you say that about almost I'm getting the sense of like the rawness of emotion and how that can really influence so many things to do with behavior.
Yeah, absolutely. And it's the immediacy of emotions. Like one thing you sort of learn to appreciate is, although they're not as sophisticated or complex as, conscious thought or rational thinking or self-control, they're a much older part of the brain, much older system, which means it's much simpler and faster. So we tend to, think about our emotional reactions and sort of rein ourselves in. We tend not to, something happens, we don't think, what have I just experienced? This happened, so I think I shall be angry about that. Yes, that seems right. We don't do that. No, we get angry and then stop ourselves from doing something about it because emotions come first. And even that framing is helpful when you look at people's behavior and actions and approaches to things, and it can be very useful to keep this in mind.
It is the idea that emotions just are and they happen, and it's not conscious thought or a choice, I suppose.
Yeah, I mean, to a certain extent, you can choose an emotion. So obviously, we do have we're always thinking about possible scenarios, and we might realize something and then go, oh, like we think, oh, if this happens, I might lose my job. And then you've had a thought, and the emotion happens, but you haven't you haven't sat there thinking, and today I shall be anxious. And then we go, it's not something, we don't have that sort of control. It just, we react, our emotions react into the contents of our head. But yeah, it's yeah, it's the immediacy, it's the significance of it, and learning to deal with that. And now our brains are always adapting, always updating. There's something called the appraisal model, where we have an emotional reaction. Our brain sort of goes, okay, we had this reaction. Was it good? Was it bad? Was it helpful? And we update for later, for later experiences. We have a similar manner, but yeah, the emotions are immediate, and have like they have the first say in our responses to things, and keeping that in mind can be quite a helpful approach.
I think, yeah, having that oversight can be super helpful for people working with children or anyone really that goes through a kind of dysregulation cycle and really struggles to stay regulated. When we say that everyone can benefit from Team Teach training, we really do mean everyone. Our in-house training puts the emphasis on the unique needs of your setting and creates a consistent approach to behaviour across your entire organisation. Head over to the Team Teach website to find out more. I thought maybe I would start with a really focused question of like, what do people, essentially working on the shop floor with individuals that might become dysregulated, what are kind of like the headlines that people kind of could benefit from knowing about how the brain influences behavior?
Yeah, in as small a nutshell as possible, it sort of helps to think about the brain as having like a sort of a balanced system. You have your prefrontal cortex, all the thinking, the logical parts of your brain, the self-control, the restraint, the planning ahead, all that stuff happens in there. That's like the ultimate human part of your brain. And that obviously tends to determine how we behave. Then you also have the limbic regions, which produce the emotional impulses, like your amygdalas, your caudate nuclei, the insula, all that sort of stuff, deeper in the brain. And they're sort of producing the emotional reactions to whatever it is you're experiencing. And these two sort of are usually in some sort of balance. Because ideally, one would never completely dominate the other all the time, because if you're always, super rational, super logical, then you don't react fast enough to dangers and risks and like aversive experiences. But if you're always emotional, you don't react logically, and so on and so on. But no, those, the logic part of your brain is usually keeping things in check. I always liken it to, if the logic part of your brain is the human and the emotional part is like a big dog, which the human has on a lead, the human doesn't really control what the dog does. It can restrain it and like lead it and guide it. And sometimes, the dog is too big and the human is too small, and sometimes it takes you by surprise and let go of the lead. Sometimes it's like a 6 stone person walking a Saint Bernard, which is obviously much bigger, much stronger, and could pull away a lot easier. So it's when like the dog gets off the lead and your emotion system takes over, because you've experienced too much aversive stimuli, too much stuff which is triggering emotional reactions. It overwhelms your logical brain's capacity to regulate and like keep control. Control is probably the wrong word, but to refine and to regulate and to keep in check. And therefore, like, your brain is overwhelmed to the point where it's only emotions which are determining behavior and actions, or at least predominantly emotions. And emotions aren't logical; they are immediate. They are, they don't think. You don't start thinking things through. You're saying, "I feel this. I'm going to express that in this way." My nervous system is responding to, or is now under the grip of a brain completely controlled by emotions. So, your fight or flight goes into overdrive. You lash out, or however it manifests in the particular individual. So yeah, the system whereby emotions and thinking usually coexist can be overwhelmed by the emotional side, and that's when you get dysregulation, because the logic and sort of self-control is being too overwhelmed by the emotional stimuli. And obviously, if someone comes from a background with more trauma, with more aversive experiences, with more childhood issues, then they'll have more emotional baggage, which can lead to that, and they'll have less opportunity to develop this self-control, which is obviously a more slow build-up system where you feedback from your parents and guardians and adult supervisors and adult oversight helps you learn this. If you don't have the experiences to learn that, it's more easily overwhelmed. So that's the sort of thing that's happening when you encounter someone who is experiencing dysregulation. The part of your brain which does regulate is being overwhelmed by too much negative, stressful, emotional stimuli, and this is the outcome of that.
Yeah, and I know that I see that in the service that I work in, that I think that word overwhelm really
Mm.
stands out. I also worked for a while actually with an adoption and fostering agency and worked with children and young people affected by trauma and also having attachment difficulties. And I remember really vividly studies around the prefrontal cortex being
Mm.
different sized for those individuals that have faced significant trauma in early experiences, so you can kind of see the kind of outcome, or the maybe underdevelopment is a better phrase. I don't know, I'm not an expert
Mm.
on it, but
Mm. It can be that. Again, if the brain is very much like a use it or lose it approach. I mean, lose it's too strong, but like a muscle, if you've got the baseline, but if you work it a lot, it gets bigger and stronger and more efficient
mm,
and more powerful. And the brain has a similar setup where, like, the more you use a certain ability, a certain process, within the realms of neuroplasticity, and it depends what age you are, but that part of the brain will usually get bigger or more efficient as like more resources are diverted to it, so you can do that better. Like you see it in studies with the classic one is London cab drivers with the knowledge. They
yeah.
have bigger hippocampi, they're part of the brain for navigation because they've had to learn how to navigate London of all places, but from memory. This is the pre-sat nav era and stuff, and you don't see that in bus drivers in London because they have a set route. They don't have to navigate; they just follow the trail they've
Hmm.
got. All expert musicians, concert pianists, they have a much bigger motor cortex for fine finger control because they use that all the time. And similarly, you expect if someone hasn't been able to, or hasn't had the opportunity to develop the self-control, the emotional regulation, the parts of the brain which are responsible for that will potentially be smaller. But there are also other sort of, outcomes which can lead to the same result, in that perhaps they've had to use self-control so much, like they've constantly regulated powerful emotions, that their prefrontal cortex could be bigger, like something swollen because it's just too much demand has been placed on it. And there are some cases of people with constant anxiety, which they have actually more connections between, like, the amygdala, the fear center, which causes the most, the raw anxiety feeling essentially, and the prefrontal cortex, which controls it. They have more connections than the average person, but that's because the amygdala is not responding to those signals. So the
Uh-huh.
prefrontal cortex is always saying, listen to me, listen to me. It's like constantly, constantly sending messages, constantly saying, wake up, stop doing that. But something's gone awry, and it doesn't react to the amygdala doesn't react to these controls, symbols, and signals. And so the shape of the brain will be altered by it, but it's not always an intuitive worse equals smaller. There are so many different ways of looking at it, and I think I explained this in team teachings before, that you can arrive at very similar outcomes via very different neurological routes, because
Yeah.
the brain is always like that. There's always, it's so many different paths you can take in terms of brain development. So, everyone's going to be unique in that respect, and it's worth keeping that in mind as well, I would say.
Yeah, that really puts it into context, and it's that, I guess, that thing when we're talking about neuroscience, that it isn't as clear cut as, okay, this part of the brain is underdeveloped and like that's
Mm.
causing all of these things. That there's, the phrase that there's many ways to skin a rabbit, and the different connections and the things that are going on. And I suppose as a thought, the idea of the muscle being sorry, the brain being like a muscle, and it can be worked and kind of changed and grow in different areas, I think can be really helpful to hold on to that when we're talking about this topic. Because I think historically, maybe in this field, there has been a sense of, if someone's experienced dysregulation, or they're struggling with their emotions, like that's it, that
Mm.
that can't be changed, or we can't help.
Yeah, totally. That is a common sort of belief in my experience from people I've spoken to, but that isn't how the brain works. There's always, like, potential for change. I think it's even a study discovered, published quite recently, that shows that adult brains do actually they create new neurons all the time. It's often believed that they don't. It's like only during childhood where new brain cells are grown, and then we've, like, those are the ones we've got. Look after them for the rest of your life. So but neuroplasticity, the ability of the brain to change itself, is an ongoing process. Even if it's not creating new neurons, it's the connections, the links between them, which are always seemingly in a state of flux to a degree. Yeah, when you hit, like, full maturity, adulthood, I mean, it's very debatable when that is, but when your brain is mostly done developing, there is, I don't know, there's less flexibility, less scope for change. But like I compare it to, like, when you're a child, your brain is like, brain is like building the house. You've still got potential to shape and alter everything. Whereas when you're an adult, it's more like remodeling the house, or like adding extension here and there. You've got the basic plan, the foundations are in. You can't change those now, but you can, alter the space itself. And that can be really useful to, to keep that in mind too. It's like perhaps less flexibility, but they're still there. But when you're young, particularly, as most people listen to this, I'm sure they'll be dealing with younger people who show dysregulation. There's still plenty of scope to, undo is perhaps the wrong word, but to sort of deal with this dysregulation. If they have a brain which has learned negative connections or negative habits, or formed unhelpful processes due to the experiences they've had, that's obviously a bad thing. That will affect the behavior, will lead to dysregulation. But even if you can't go back and completely undo those connections, the brain has so much resiliency, so much redundancy in place. There are ways, there's potential to form a workaround. That is basically what therapy is, whether it's cognitive behavior, whatever, sort of coaching your brain to form new connections to arrive at the point you want them to get to, which don't go through, the bad process, the bad networks, the bad connections, which lead to this outcome. Form new paths, form new connections between, outcome and behavior. And like, if you go this route, you won't go through the dark place. You won't go through the dangerous path. You'll go through this one. It takes a while to work your way around. It can be longer to form that path, but it's still an option. And that is always the case. Even if you got the worse someone has, the more stressful life they've had, the more work is required to get them to the point where they can be, functional. They don't dysregulate, but it's always an option. There's always that possibility there. It takes an expert person to find it, to get to that point, to be able to work with them. You can go through many different individuals to see who can help them do this, but it's always an option, because that is how the brain works, especially when you're young. There's always time and scope to work around, or like, again, I don't think reverse or cure. Those aren't how brain works, but to form new pathways, new connections, which lead to the outcome you need and want, and not the one you currently have.
Yeah, I've got this idea of like a hack, like in computers, that you're trying to like program and find this hack to kind of work around some of those things and develop things in a different way. And I know when I deliver team teach courses, actually, I do really hold this kind of science in mind, particularly when we're thinking about regulation and this idea of rehearsing, practicing, that trying to help a young person, adult, whoever we're working with skills, we need to rehearse it, we need to practice it, be in the moment. Because I'm really conscious of knowing like some of like this science, that we have to help like build those pathways, those hacks, those workarounds, and we've got to keep going with it. It's not like, okay, you say this and then you're going to suddenly be regulated. It's about kind of walking through it and being familiar with it, and practicing essentially.
Yeah, totally. I think there's still like a strong tendency in not just this area, like the world in general, to look for the quick fix, look for the cure, the treatment, the magic bullet which will solve this. And that's just not how brain-based things work. It is a gradual process. The brain is an incredibly powerful and flexible organ, but it's not the fastest in the world when it comes to reshaping itself. It's a gradual process. And that's something, there's no way around that. And we can't accelerate the brain. If we could, it would probably be a really bad idea, because it's already operating at, in terms of biological demand, it's already at maximum. It's amazing it can do what it does with the power it's got. And, this idea that, if you just like do this, X, Y, Z, like you can see this sort of thinking in the wider world too. Like the idea, think about the existence of chat-up lines, the idea that you can go up to someone and say a combination of words and suddenly they go, "Oh, I love you now." Like, well, that's not really I don't think any human's ever been like that. We don't have cheat codes. We don't have passwords. That's not how the brain is set up. But people still want that. And for good reason all the time. If you have a troubled child you're trying to deal with, the desire for a quick and easy fix is obvious and very noble. But it's not going to work like that. Like, I think people think medication can do that too. The idea that you take a pill of some sort and then a day later, good, fixed. Again, there aren't any, I don't think any medications really do that, but particularly when it comes to psychiatric or neurological ones. I think
Hmm.
actually one of the most effective medicines in terms of dosage versus outcomes is actually Ritalin, an ADHD medication. So there is scope for that, but even that is none of it's never guaranteed. It's still a long-winded process. It's just a surprisingly good one compared to other options. So yeah, this idea that there is a quick fix to be had is understandable, but I think unhelpful, because if you think there is one, you're trying to find it. What you're not doing is doing the actual legwork which is required to address the issue, in a way which will work. So I think trying to find an easy solution whilst ignoring the hard one is probably just prolonging things and letting the issue build in or embed even further, which probably isn't good for yourself or the individual you're trying to help.
Yeah, and everyone's favorite thing on a training course is we want a quick fix, we want a magic bullet, and you have to deliver some quite bad news of like, oh, actually, yeah,
Mm,
I want that too, but yeah, it doesn't exist yet.
yeah.
And maybe, like you say, that's a good thing. And I suppose I'm wondering, maybe the listener is that if we have kind of studies or evidence of the things that can really help individuals that struggle with dysregulation to regulate, if we know some things that, yeah, really do
Mm.
help.
There is like if you look at a lot of work done like the neurodivergent communities, there are things you can put in place to help someone cope with the situation that tends to overwhelm them. So identify what it is which causes the dysregulation in the first place. If there is a way to find that, is it a certain person? Is it a certain way of interaction? Is it a certain situation? Is it a certain sensation? Like people being too noisy around them, like the clattering of a spoon. Like these are all things which can um, lead to dysregulation due to all the previous thing they've gone through and experienced. Yeah, so like try and identify the reason for the dysregulation, and
Hmm.
then give them the tools to manage or avoid it. It's how important is it that they have lunch with the other kids if it's triggering them this way, or how important is it to they do a certain thing which causes them issues when there are other options available. And I do think this, most of the um, literature says there's the individual. Like, I think a lot of it comes from mental health care and stuff. So sometimes they're the
Hmm.
patient, but we're talking like the individual here. They need to be a part of the solution. So you don't sort of look at them. Okay, I think they have this issue, and I'm going to put this thing in place to make sure they don't have it anymore. Yeah, good. It's not how it works. Like maybe with a physical issue, like someone's got a broken leg, a
Hmm.
doctor who specializes, okay, well, I know how to fix a broken leg. Well, you put the cast on, you say, okay, you stay off your leg for this long, you do these exercises, you keep it elevated, and come back to see me in 5 weeks, and we'll look. That is a sort of a set procedure because we know how the body works and we know how everything's set up. But when someone's got their own internal issues mentally and they're based on their own life experiences, they need to be a part of that
Hmm.
process, because otherwise it's you get more people telling them what to do with their life, which probably is a big part of where the dysregulation comes from in the first place.
Hmm.
So the individual needs to be, but ideally would be a part of the solution, and they
Hmm.
help to work out their own um, interventions, and that to give them autonomy, control, a sense of individuality, and say over what happens to them. That invariably does help a lot, because obviously a lot of the time dysregulation comes from not having those things in whatever shape or form that comes from. So yeah, involving the individual in the process
Hmm.
can be a really helpful first step, if nothing else.
Yeah, that agency and control is so important, and I
Mm.
definitely have seen that in practice in my services, where yeah, you see when that bit of choice control is given to someone, they're more likely to kind of I don't want to use the word buy in, but that's all I can think of. But buy into the idea that we're trying to help, and yeah, that we're all part of a
Yeah.
team, as opposed to working against each other or telling someone what to do. I think I've seen that in practice make a really big difference.
Mm. Yeah, it's basically it's intrinsic motivation as well. Like
Yeah.
there's the thing of extrinsic motivation. You say to someone, do this, I'll give you money or a reward. They go, okay, well, I'll do it because I'll get the thing that they're offering. Whereas if you give them a say in the process, they become intrinsically motivated. They want to do it for their own sake. Like, well, this is my decision. I am doing this. I am controlling my situation. And that can be a lot more enduring, a lot more long lasting as a motivation and as with the outcome. And when someone, if they are part of the process, then more of their brain has been engaged in the process, which makes it, again, the more active your brain is in something, the deeper it sinks in, the longer effects last. It changes your brain to accommodate that. So if someone has a direct involvement with their interventions, whatever it is, they are more likely to be effective because they are genuinely involved in a way which is far more significant than if they're just being told, this is happening to you, it's good for you, endure. Like that's obviously there'll be some people who are too young or don't have the capacity, so you have to do that.
Yeah.
But in most cases, then having the person involved will be the better option.
Yeah, it's really fascinating when you get down to it. And I'm so conscious that this was your thesis and we're trying to condense it into 25 minutes.
Yeah. Yeah,
But I
mine is
think
actually behavioral neuroscience memory specifically, so it's not, it's a
not
bit more,
quite this,
it's a bit more
but
fundamental. So, yeah.
someone's definitely written a lot
Oh
about
yeah,
this
I've seen
topic
them
and
do
spent
that.
so much researching it. But
Yeah.
I suppose I just wondered, as the last thing for the listener, 3 top tips or kind of a summary of what you've brought up today.
Yeah, I think one important thing to keep in mind, I think, is that if you have someone who is dysregulated, it's extremely unlikely that they are doing this on purpose to be disruptive. They are like the victim here, not the sort of the perpetrator of the circumstances they've endured. This is how they are because of what they've gone through, and they don't usually don't want to be doing this. They wish, ideally they probably would like a better coping mechanism or whatever it is they've got, but they don't have one. So they're not doing this, deliberately. They're not constantly saying, I want to disrupt things, I want to dysregulate. And even if they are sort of thinking that, it's probably because they've gone through what they've gone through, or like they've developed in the way they have through circumstances which are beyond their control. So I think it's important to bear in mind that, someone who's dysregulated isn't choosing to do this. They are the end result of what's happened to them. So like apportioning blame is probably not the best approach there. So I think treating people who dysregulate as, maybe not equals, but as more of an equal. It can be helpful, particularly if they're like adolescents, if they can see you as a peer rather than an authority figure. That tends to be far more effective with people in that stage of development, because that is when your brain's going, no authority, I want peer, I want friends, I want validation from a community. And so if they can sort of use that, co-opt that into your intervention approach, that tends to be a lot more useful, a lot more effective. It's a negotiation, not instruction. You want them to take part. You want them to want to take part, and you can't really do that just by finger wagging and saying, "Okay, this is what happens to you." Again, there's always exceptions. Some people won't have the capacity, won't be old enough to do this, so there are ways and means around that. And I think acknowledging someone's emotional expression is important, because a lot of the time this regulation comes down to, I have too much emotion built up and it has to go out somewhere. So, if someone is upset or angry, it may not seem like you might say, well, no, there's no reason to be angry. There's no need to be angry about that. That's not how emotion works. They are angry about it. It has angered them. Therefore, they are angry at it. Now, to logically explain, there's no reason for that. You're being, it's almost like a value judgment. It's a sort of like it's an implicit criticism, which isn't really helpful in this situation. See the emotion, accept it as you are having a lot of emotion right now. Get out your system. Let's start again, because the dysregulation will not last forever. It is if anything, it's a brain sort of way of going. Just as sort of, I need catharsis now. I need to express these feelings in some way, shape, or form. Otherwise, it's going to build up and overwhelm me even more, in a more stressful, more harmful way long term. So okay, one ramble so much. I forgot the first thing I said now. So so dysregulation isn't the individual's fault. Treating them as a valid contributor to the process, not a sort of a subject or a problem to be solved, is probably the better approach. And the emotion they're experiencing is valid to them, and to try and sort of stop and suppress it might be a practical idea, but it's not going to be helpful to them personally. So it's not going to be a good long-term strategy.
Yeah, I love that. And I think that listeners will have, such practical things to take away. And I'm going to take away this kind of misconception I had about the prefrontal cortex, and that there's many ways to skin a rabbit and kind of workarounds in the brain. So yeah, I really enjoyed it as always, Dean. And yeah,
Thank you
hopefully
very
we'll have
much.
you back on soon. Take care.
Oh, 3 times, I think. Third time's a charm, as they say.
You've been listening to the Team Teach podcast. It's been great to have you here with us as we discuss behaviour, communication, and the ways we can best support those in our care. Thanks again, and I'll see you next time.